Hello, I'm Dr. David McDonough from Metaesthetics OC, located at 12721 Newport Avenue, Suite 3, Tustin, California, 92780. And I am excited to talk to you about phentermine, a stimulant that serves as an appetite suppressant for weight loss. Here at Metaesthetics OC, we want to make sure that you understand the medication and any risks and benefits and how it is to be used safely. I would advise you to take the medication at 10 a.m. to 12 noon on an empty stomach, 1 hour before food or 2 hours after food with a glass of water. The medication lasts 6 to 10 hours with an average of 8 hours, so you want to adjust the time to get you the maximum appetite suppressant effects from the stimulant. In addition, you want to take it early enough that it would not affect your sleeping at night. After 1 to 2 weeks, if your appetite is not blocked by 30 to 50% and you haven't seen any significant weight loss, then let us know so that we can, as needed, increase the dose or even add an evening booster. The goal is to block the appetite by 30 to 50% so you lose a minimum of 1 to 3 pounds per week, which is a safe rate of loss. Since this diet medication is an appetite suppressant that also works as a brain stimulant, an increase in energy, nervousness, jitteriness, moodiness, or insomnia may occur but should be lessened or gone by 2 to 4 weeks. This is the reason we start with a low dose. Make sure to be careful when driving or operating any vehicles and machinery. Prior to starting the therapy, we will have you come into the office for an EKG, vital signs, and a medical clearance to make sure you are safe for the medication. Since these medications are brain stimulants, avoid other stimulants such as caffeine, energy drinks, decongestants, pre-workout, and especially alcohol. Alcohol interferes with the appetite suppressant's ability to block cravings. Alcohol can also cause dizziness, which can lead to many other problems. Alcohol is also a high calorie intake. If you are going to take a social drink on the weekend, then do not take these diet meds the morning of. If you're going to take the social drink any day of the week, refrain from taking these diet meds that same day. Please drive carefully. The most common good side effects are brain stimulation, increased energy, and a positive mood. Some of the bad side effects could include dry mouth and constipation, so make sure to drink lots of water. If you're undergoing surgery and require any anesthesia, stop these medications 2 weeks prior and make sure you inform the anesthesiologist of the medications you have previously been on. When you reach your ideal goal weight, then maintenance strategies are important. You have at least 3 options. Option 1, taper the meds off over a 2-week period by taking the same dose every other day for 1 week, followed by the same dose every 3rd day for a week. Without a taper, depressive symptoms or an appetite surge could occur. Option 2, you can continue this medication long-term at a reduced dose by taking the same dose every other day. This could cut your cost in half and decrease the total amount of medications by 50% in your system in the long term. Option 3 would be in cases where full doses are required to prevent return of appetite and weight gain, so this medication can be taken daily for long term, just like for any other chronic medical condition such as diabetes, hypertension, arthritis, etc. A clinical resource study has confirmed that 8 years of continuous use was safe in correct doses with frequent monitoring. Both the Obesity Medicine Association and the American Society of Bariatric Physicians also advocate possible long-term medication use when necessary. This third option is sometimes necessary because in some subsets of patients, up to 90% of the people involved may require long-term use of the stimulant to avoid regaining the weight. Make sure to be aware that any mental health issues or medical issues should be discussed with us before we start the therapy. We monitor you carefully with monthly visits that include as a minimum a blood pressure check. We are always available at Metaesthetics OC for any issues that may arise. Feel free to contact us at 714-716-6395. We can't wait to see you here.